Hi, everyone. It's Anita Lambert, your holistic health physio. And with me today is Hannah Ross from Vital Physiotherapy that many of you already know. Good to see you, Hannah.
Hey, Anita. This is our long lost Facebook Live.
I know. It's less often now, but we still make really good topics that we need to talk about. So today we're going to be talking about a pelvic floor topic that many people have no idea actually exists or that it's related. So we're going to be talking about how the pelvic floor issues, or how pelvic floor actually relates to bowel issues, including constipation. And we're going to talk about tips you can actually start using today that can actually help. And so oftentimes bowel issues are thought of just digestive issues, which definitely digestion is a part of it, but so can also the pelvic floor be related to it. So thank you so much for joining us, and please say hi. If you have any questions or comments, feel free to leave them below, and we'll be sure to get them either during the live recording or after on the replay.
Yeah, so I mean, I think a big thing that we always talk about is that the bowel issues are not necessarily something that people even know to come in for, but it is something that we flag during our intake at some point, right? Like a lot of people are experiencing even not only constipation, but on the opposite side, fecal incontinence, issues with gas, things like that. That often comes up within like the first 10 minutes of our interview. And like everything else that we talk about, a lot of these things are common but not normal, and they are treatable. So I think that's it's a great thing to talk about, because we say, like, if things aren't working well there, people ain't happy. So if you do know somebody, not something, you don't have to tag them in the comments, but if you have a friend or a cousin or an aunt or a mother or an uncle, or, who's experiencing, these kind of bowel issues, send them this video. They can start to get informed and hopefully address those issues. Mm-hmm. And if you're a healthcare professional, it's also really important to know that sometimes it isn't just as simple as addressing the digestion or taking a food, addressing it with food or other. Sometimes there really is a pelvic floor issue that's involved. Mm-hmm. So should we dive right in?
Let's do it. Yeah.
All right, let's be crazy. So let's start off with, how is the pelvic floor related to the bowels?
Yeah, so I often explain this to clients. So again, as Hannah just mentioned, it's initially in our history when we're asking a lot of pelvic floor symptom questions. And I always tell clients, a lot of times you may not think the bowels are related, but they are. And once you see how the muscles relate to the bowels, it makes a lot more sense. So both Hannah and I have our, there we go, pelvic model as usual. So just to go over, if knowing where your pelvic floor is something new. So I'll show you in terms of the pelvic floor basically attaches from your pubic bone to your sits bones to your tailbone. So the whole diamond shape, that whole red area is actually your pelvic floor muscles. Right. And there's 3 layers to those muscles, but if you'll notice, we often talk about, as physios, we kind of talk about the front triangle and the back triangle. So the front triangle of your pelvic floor would be the vaginal opening, and talking about the front aspect. So the bladder would sit in front of the front area, and talking about your cervix.
I have my bladder with me.
Yeah, perfect. There we go. So now that's great. So with Hannah's model,
put them into place. Okay.
Yeah, I know. I don't have mine in currently. So yeah, you can see. So Hannah's showing the bladder, and then the cervix and uterus sit right behind.
So there's bladder, uterus.
Yeah, and then you'll see the bowel sit behind. And so you'll see, this is great because you can see on Hannah's model, and then I'll show you from the outside. So the back triangle, so the bottom part of the pelvic floor, that it would look like on the model, looks like the bottom part. That triangle is our bowels, right? So in terms of the rectal opening, and you can see in Hannah's model how the rectum sits behind.
Yeah.
So that's why it's important, because in terms of oftentimes, especially if you've been taught to do Kegels or told to do Kegels, we think the pelvic floor is just little tiny muscles at the front where you would stop pee.
Right.
So a lot of clients first time coming in are surprised to know this has anything to do in terms of back here. So we're going to talk about a lot of different symptoms that could be related to, again, that posterior or back part of the pelvic floor. So that could be in terms of constipation, so straining with bowel movements, pain with bowel movements, hemorrhoids, fissures, leakage of stool, or leakage of gas.
Yeah.
And definitely those two, I think a lot of people have no idea that that's related, and that it can be just a muscular issue.
Right.
And then also IBS can be related in terms of to the pelvic floor. We're not going to dive into that topic as much today. That'll be for a future episode. But just to give you an idea what some symptoms that you may be experiencing, or if you're a health professional, maybe your clients or patients are experiencing, and to know this actually could be related to your pelvic floor.
Yeah.
So why don't we go into first, Hannah, if you could talk about how is the pelvic floor related to constipation, hemorrhoids, and fissures?
Okay.
And even if you can explain a bit what hemorrhoids and fissures are, because some people don't know the difference or haven't heard of them.
Right. So, I mean, we talk about this a lot, but the pelvic floor is our muscle, like the pelvic floor muscles, they're muscles like any other. So we can see, we start to encounter issues when those muscles are not strong enough. So if they're weak or flaccid and not doing their job, but we also encounter issues when they're too tight and they're not able to relax enough. You can see around the bum here, there's a little sphincter. And that's the external anal sphincter muscle. There's also a sphincter muscle that's inside, a little bit deeper. And the job of those sphincter muscles is actually to relax and allow you to move your bowels when you want to go, and not when you don't want to go. And also to hold them in when you do want to go. So the sphincter muscles are circular and they squeeze, right? Constipation arises, from a pelvic floor perspective, so taking the digestive stuff off the table a little bit, when you don't know how to relax your muscles well enough, and so stool starts to get backed up, and you can't release it well. The hemorrhoids and fissures can happen for a whole slew of reasons. We see it a lot with persistent constipation, but we see it a lot also immediately postpartum with intense pushing of any kind. Sometimes pushing for a bowel movement can be as intense as pushing for multiple times pushing out stool, working really hard can sometimes have the same effect in your pelvic floor as pushing out a baby. And what a hemorrhoid is actually it's a varicose vein in your rectum. It's a vein that's actually gotten that doesn't have the ability anymore to return blood back to your heart, and so blood kind of pools there, and you can have them externally, so people can see those veins. They'll almost look like little bulges, or they can be internal, and they often get mixed up with fissures because a fissure is actually a cut within the rectum. And both often come along with blood or bloody stool. But I like to tell my clients, like, if you're trying to push poo out of this, right, you're gonna be working really, really hard. So it's the same thing as like holding your breath and going. A lot of women we see actually pop blood vessels in their face when they're pushing. It's no different down there, right? So learning how to actually release those muscles and allow that stool out is a really, really important lesson to learn. It's something that affects your function greatly.
Mm-hmm. And we'll go a bit more into it, and how Hannah talked about it. So tension in those muscles can come from various reasons. So as you talked about, like pushing, straining, even someone who's never had a baby, if they've had constipation their whole life, that can be part of it. But also stress plays a role too. That a lot of times we hold our stress in our pelvic floor, which doesn't make bowel movements any easier because it's kind of your stool is fighting against this tension.
Yeah.
That's
and also,
happening.
A lot of people, their bowels are actually affected by stress. So a lot of our clients will say, "Oh, when I'm stressed out, my bowels are looser," or I get stuffed up. Like we do respond to those stress hormones in different ways, and our bowels certainly do respond as well.
Mm-hmm.
The other thing that I wanted to mention was that the same way that we can actually learn to clench and not release stool. Sometimes if once you get used to clenching, you can actually start to lose a sense of when there is stool ready to come out, and that also perpetuates the constipation. So when you stop listening to your body signs that you have to actually move your bowels, your brain can actually start to learn not to pay attention to it. Mm-hmm. So we always say, pee you can hold, bowels go. When you gotta go, you gotta go.
And so what we just were summarizing, so this is just, again, the pelvic floor component. There definitely is, and often is, a digestive component, hydration component too. So to know there are both sides of it, this is just a side that no one often talks about. I've worked with some amazing naturopaths over the years, and we often will work together with clients who are having some of these issues, because they can address some areas in their scope of practice and their expertise. And then I bring in the pelvic floor side. And then in a combination, then the client sees some amazing results too, if both sides are related.
100%. And we do dabble in it a little bit. We will talk about water intake and a little bit of fiber. But when it becomes a little bit more complex, we'll step aside and we'll start to work together with somebody who's even a dietitian or an naturopathic doctor, somebody who's more focused in that area.
And then why don't let's go into fecal incontinence, which is leakage of stool, or leakage of gas. And often a common question I get is like, does this only happen when the muscles are really weak? And the answer is yes. And there's more to it than that. So similar with constipation.
Have a good night. Okay.
There's more to it than that. If it was only that easy. So oftentimes some factors that can come into play are as if there's tearing or episiotomy. And if that tearing or episiotomy has gone to the extent of the rectal opening or the anus, that can definitely affect, because they put obviously stitches in to bring the tissue together. But as you've heard Hannah and I talk about in the past, the sutures or stitches bring the tissue together, but there can still be tension or tightness in the muscles around that area. So there may be leakage of stool or gas due to weakness, but actually initially due to tension or tightness in that tissue. And we've talked before about if you picture a bicep curl, and if you picture kind of the top of a bicep curl, and then basically you don't have much left to contract at the top of that curl. Yes, Hannah will demo there. Yeah. So that's all you get.
I expect comments on my bicep.
So if we release, Hannah's going to release her bicep curl. So if we release tension, then when she goes to contract, she'll get a much more efficient contraction. And that's the same way the muscles work in the pelvic floor, whether it's in the front triangle or the back triangle. So it may actually be a tension issue. So if this sounds familiar, if you're experiencing those symptoms and you've had a tear or episiotomy in that area, it's something to consider that could actually be the reason why. And as pelvic physios, we see women all the time with this, and definitely it can be resolved conservatively with physiotherapy. And then for others, it may not be a tension issue. It may be more purely a weakness. So it could be that sphincter that Hannah was talking about, that it just doesn't know how to tension and tighten and lift properly when you feel like you may need to have a bowel movement, or if you're trying to stop gas. So there can be two sides to it. So it can be working on releasing tension, but also in terms of increasing strength in those areas. And sometimes it does happen soon after birth, but sometimes it doesn't happen until years later. That symptoms come on. And often, again, we've talked about with other pelvic floor symptoms, is sometimes it's not until menopause when there's like another hormone shift in the body. So to know it can happen soon after birth, but it can also happen at any point after with that.
And something that's really cool that we can do with pelvic physio, even aside from strengthening or releasing those muscles, is we have a couple of really cool tools that can kind of retrain that sense of when that rectum is full, and train those muscles to actually contract around, and also how to release, what it actually feels like to release. Because with some scar tissue problems, people actually lose a sense of how to use those muscles and what that feels like.
Mm-hmm. And I love this. So Lindsay commented, Lindsay's an amazing physio. I actually went to school with. So thanks for watching, Lindsay. Hi. And she asked a question. If you are a chronic bum clencher, could that lead to short, weak muscles? And the answer is yes. And sometimes
most women are, though, as well.
Yeah. We often, I tell clients, as women, and kind of it's subconsciously there growing up, we're told to tuck our bum under, suck our belly in, and lift our chest. And I tell them actually our pelvic floor and core would prefer us to do all of the opposite. Let your bum untuck, relax your abdomen, and let your chest and ribs soften. So yes. And what can actually be good, Lindsay, with that is if that's a habit, for some, just changing that habit is enough to release that tension. For some, there's more to it than that. Once the habit is undone, there's other tension sitting there. But for some, it's actually more, once we change that habit, we see tension change very quickly. So that's a really good point. And that
also might be a coping mechanism, right? A lot of our clients will actually tuck protectively, right? And that will lead to similar symptoms.
Mm-hmm. Yeah. So it's a great question. And very, very common that we both see in our practice. So why don't we go to, because we promised off the top, we're going to give you some tips that you can already start with today. So Hannah, why don't you start off with our first tip?
So I think this is top 10 favorite items that we suggest. I will say you don't have to go brand name with this, but it's pretty awesome. There's a product called the Squatty Potty, and the Squatty Potty is a stool. They say it's a stool for better stools. But basically, when you're sitting on a toilet and you're at 90 degrees, your knees and your hips are sitting at 90 degrees, the muscles in the back of the pelvic floor are actually still in a contracted state. So you're still resisting. You're still resisting that release of stool. When we go into a squatted position, we talk about doing that before labor and delivery. We talk about that as a way to manage pelvic pain. Putting your knees up higher than your hips when you're sitting on the toilet actually puts those muscles into a relaxed state. Mm-hmm. Life-changing, people, life-changing. Now, Squatty Potty is awesome because it actually fits around your toilet. They have hysterical YouTube marketing.
Unicorn videos. Yeah.
Yes. But anything really you can put your feet on. I have clients who will use yoga blocks. They'll use, they'll turn their garbage upside down, trying to keep the little bag aside so you don't pour garbage on the floor. But
or I have a lot of my moms, and now I know too, having a toddler, and I know Hannah's the same, is that if you have kids that are needing a footstool in the bathroom anyways, you likely have one. Yeah. That being said, it may not be high enough. So you may have to play around with height, but at least it's something to start with. And also, as Hannah talked about squatting, it's not enough to squat over the toilet. We want to make sure you can't just hover over the toilet. That does not do the same thing.
Activate. You actually haven't released those muscles. Yeah. It's one of our big no-nos, actually, is squatting over the toilet.
Yeah, because your muscles will be, they'll be tense and your knees won't be above your hips. So it's kind of two things working against you. So you need to really sit, we call it a passive squat. So you need to be really relaxed, to have your feet up on something, and holding your legs doesn't work either because you will still be tense. So they need to be up on something. I go through all these different things because I know clients start to be like, well, how else?
See, this is not the first time you've done this.
No. So I know I'm at home. I'm like, we have a Squatty Potty in our bathroom. I just think
put the YouTube video link in the
links below. It's amazing. So again, we're not saying you have to get the Squatty Potty. Start with a footstool, but some people end up deciding, you know what, I just want to have one that's more convenient, and that you can just fit underneath. So that would be definitely one of our top tips. Another one is increasing water intake. So
how much do you tell your clients to drink? Just out of curiosity.
For everyone, it's going to depend. So we talk about caffeine, sugar, carbonation, alcohol tends to cause dehydration. And again, everyone's going to be a bit different. So this isn't like a hard and fast rule. So usually we'll go through cups of water or herbal tea, fluids like that the bladder and the bowels tend to favor. And then we'll take the cups of those other items, so coffee and all that, and subtract them to see where they end up. And I mean, generally you hear people talk about 8 to 10 cups of water a day. Subtract those other things. But there's so many different factors involved too. And I tell them, when you go pee, look at the color of your pee, and it shouldn't have an odor. It should be a very faint yellow. So everyone's going to be a bit different, but definitely want to have someone coming in that they drink 5 cups of coffee, maybe 1 cup of water. We need to start moving stuff. But again, both Hannah and I are similar. We're not going to automatically be taking away your coffee. We're going to start with bringing up your water and starting to balance things out. So don't be concerned that you're going to see someone that will take away all the fluids you do enjoy. We just may need to bring up your water first and then start to balance things out. But it can greatly make a difference with both your bladder habits or symptoms and also bowel symptoms as well.
And one of the things I say with water, it's kind of like, how you speak in a relationship. It's like not what you say, it's how you say it. It's not necessarily, how much you drink. Sometimes it's how you're drinking it. So, I have a lot of clients who, when they are writing down the amount of water they're drinking 4 liters a day, and they're still like ravenously thirsty. Like they're still feeling so dehydrated. And when we talk about it, they are just taking bottles of water and they are chugging. And what that does is creates a stretch reflex in your bladder, and your body can't actually use that water. So you're still remaining fairly dehydrated when you're chugging that water. So even taking the time to drink the same amount of water, but sipping it will often have the same beneficial effect. Having said that, if you're having 5 coffees a day and half a cup of water, we're probably still going to increase your water.
To increase that. So So we're kind of looking at the whole picture in terms of fluid. And then also there's other ways people are getting water and they just don't know it, whether it's like, especially the clients I have who are vegetarian, things like that, like we're keeping in mind how much water you're taking in from food as well. But just something, again, just as a tip to keep in mind, to take a look at your water intake if any of these bowel issues sound familiar, because changing that can make a difference.
Super easy.
And then what about fiber, Hannah? So I know we talked about naturopathic doctors as well as nutritionists, dietitians. They really look into this as well, but we do end up talking about this to a degree with our clients. So what do you end up talking to your clients about in terms of bowels?
We talk about balancing. There are different kinds of fiber. There's soluble fiber and there's insoluble fiber. Your body actually needs both kinds in addition to water. So, if we have clients who are just eating fiber but not drinking enough water, what that actually kind of creates cement in your belly. Whereas if you're having one type of fiber but not the other, that could also affect your stools. So soluble fiber and insoluble fiber, one is, that your body actually the one that goes through you, and one is the one that your body actually uses to help cement the stool as it comes through you. But but what is I try to keep it simple. So I have a whole list of things that have both soluble and insoluble in it. Things like apples and pears. And I'm like, if you think you need to add some fiber, let's just add, like old adage, like an apple a day keeps the doctor away. Add in an apple. I certainly have lists of both kinds of fiber, and if it's something that we need to address, we'll look at both of them and compare what somebody's eating. But oftentimes it really is as simple as adding in a piece of fruit with the skin that has both kinds of fiber, along with increasing water. Like 80% of the time, this simple stuff really makes a difference, and otherwise we can get really complicated with it, and that's okay.
Yeah, no, that's a great point. And then going a bit back to how the pelvic floor, what you can do specific for the pelvic floor while you're having a bowel movement is actually learning to relax it. So if you do see a pelvic health physio and you do have tension or tightness or these symptoms, they'll figure out what cue works best for you. You've heard Hannah and I talk about in past videos. We'll make sure to link it in the resources too, but that flower bloom breath, which not only works for the front part of the pelvic floor for tension, but also tension rectally as well, and especially with bowel movements or any pain around the tailbone, which would be the back part of the pelvic floor as well. So learning about that, and we'll have another resource we're going to talk about that you can use with bowel movements, which is pretty awesome and free and easy to find on YouTube. So we're going to, in terms of something to keep in mind is are those muscles, if they're clenching or if you're anticipating it being painful, it's just working against you. So finding ways that you can actually release and relax. And the squatty potty is one of them, because it naturally will help relax those muscles. It may make you feel more comfortable and more confident having a bowel movement. I often will tell clients, especially preparing with their postpartum items, if they don't already have a squatty potty or a footstool,
get one.
Because especially that first bowel movement after you give birth, I remember Hannah and I, like everyone is a little bit anxious about that bowel movement, right? So I found having a stool, I know personally helped me, and it's helped clients just naturally relax those muscles to make that just a smoother transition with that.
Yeah. I love it. And I think this is like, our next suggestion is actually really related to what Lindsay was chatting about. If a lot of people who are bum clenchers are doing it as a coping mechanism related to stress, we find that every time, something stressful happens, they clench their bums. So oftentimes addressing that stress is going to be helpful. Sometimes we can't change the actual stress in our lives. We can start to explore coping mechanisms around them. Things like meditation, mindfulness, yoga, tai chi, qigong, things that get us into more of a relaxed state. Even something as simple as a bubble bath can really start to help to release and allow those muscles to let go a little bit. And so I think that that's a really important point in the big picture for constipation and other bowel issues as well.
Yeah. And then specifically a tip for if you are experiencing hemorrhoids, witch hazel can actually be a great option that can be helpful, whether it's, right after birth or later on. Yeah. So if you haven't used that yet, potentially that could be helpful in terms of relieving and helping with them healing as well. And to go along with hemorrhoids too, some people, when they have hemorrhoids, for some people, they get to a point where they might stay external, but they're just not irritated anymore. So I end up telling clients that, they may end up just kind of blending in with the rest of, like, the coloring will be similar to the rest of your skin in the area. When they get irritated and they're not happy, they will get red and inflamed. And that's when you'll have the pain with bowel movements and blood on the tissue when you wipe after a bowel movement. So to know that potentially they might stay external. For some people, they return internal, and there's no way to know which is going to be you. But I've had a lot of clients who've had both ways, and the ones who end up, if they stay external, as long as they don't get irritated, you don't even know that they're there. Yeah. And they can shrink in size as well. So then you really don't even know they're there. But again, if you go through about a constipation, they flare up. And then you go through your management strategies, and then they calm down again.
Right, and that's also why we call it constipation management, right? Because this is something that we have to that is constantly in flux. People find when they travel, when they're eating differently, when they're sleeping differently, their bowel movements do change, and so all of this is about managing the constipation in order to manage things like hemorrhoids and other abdominal pain or symptoms like that. And a really good, we've talked about this already, but a really great addition to seeing your pelvic floor physio would be seeing somebody like a naturopathic doctor or a dietitian or a nutritionist, somebody who's going to help you address that diet piece in a more thorough way than a pelvic floor physio can. Again, we can dabble in it, but it's not really our area of expertise. We can just provide some general suggestions around the food intake portion of that.
And so we'll go to, and we're going to post these resources as well. So kind of two of our top resources. So the squatty potty that we brought up. And you can get it online as well as certain stores. Like if you're in Canada, I know Home Outfitters, Costco has them now, of course, in bulk. You can buy two. And various clinics. There's a physio clinic in town that they sell them as well. I think even Canadian Tire might have them. So you're going to see them a lot more places.
Bath and Beyond. I think there's a whole bunch.
Yeah. And then another great resource. So it's called, you can find it on YouTube. We're going to post it. It's called The Toilet Meditation. And it's by Shelley Prosco. So she is a physiotherapist, and her focus is actually yoga in terms of her physiotherapy practice. She's from the west side of Canada, and Shelly's just fantastic. She has so many amazing resources, so definitely check her out regardless. But she posted really kindly on YouTube, so you can access this for free. And so she's, in terms of in a seated posture, using a stool, and going through meditation that you could use that can be so helpful for constipation or straining or any issues with figuring out how to relax for a bowel movement. So I highly recommend checking that out. And if you're a health professional or fitness professional, definitely share this with your patients, because it can really change how they feel during, in terms of during a bowel movement.
Yeah, amazing. Another awesome resource is seeing a pelvic floor physio. I think this is like one of the areas where you really don't, a lot of our clients really don't know how to release this area. And so it's a huge aha moment when they realize that they've been clenching their bums instead of actually fully releasing. So we can't stress that one enough. The I love you massage. A lot of my clients have told me that they do this on their kids, but the I love you massage is a clockwise massage on your belly to actually move things through your digestive system, to move it through your intestines. And a lot of people find that, listen, like we know that it changes something in your brain. And so sometimes all your intestines need is like, oh yeah, we're supposed to do that. And then they start to go back to what they were doing. But it feels really nice. You can do it on your belly with lotion, and it just really is a way to, from an external perspective, start to move things through your abdomen if they're not moving quite as quickly or efficiently as they would like.
Yeah, great for if you're feeling bloated after you eat. Yeah. It helps things.
We call it I call it the probiotic of massages, because it's great if you're constipated, but it's also great if your stool is loose or you're feeling gassy. Just like probiotics. And the last one that we wanted to talk about was something called an anurex tube, which is basically like a icicle, a little popsicle icicle that you insert. That's really, really, really relieving for fissures and hemorrhoids. And so when you're having that flare, it's something that can really bring down that swelling and inflammation immediately.
Yeah, especially if you're looking for something that's not necessarily medical, or in terms of taking like a medication for it. This would be a natural way of helping to relieve and helping heal as well. So we'll make sure to post that. Amazing. So Hannah, how can people contact you, especially people who are listening who are like, I have these symptoms, I need to get these addressed. So where can people find you and your clinic?
Yeah, so I'm at Vital Physiotherapy and Wellness in Midtown Toronto. You can find us at our website, vitalphysiotherapy.com. You can find us on Facebook, Vital Physiotherapy and Wellness. You can find us on Instagram, Vital Physiotherapy and Wellness. And we really are so happy to answer any questions. I think both Anita and I really recognize that this wasn't going to be a Facebook Live where we were necessarily having tons of live chat, because people don't necessarily want to chat about it, but you can absolutely get in touch with us, ask us questions. We love to help out in whatever way we can. And Anita, what about you, my dear? Where can people find you?
Yeah, so you can find me through my website, holistichealthphysio.com, or on Instagram or Facebook at Holistic Health Physio. And my clinical practice is in Peterborough, Ontario, called Holistic Health Physiotherapy. So be sure to like both the Holistic Health Physio and the Vital Physiotherapy and Wellness Facebook page, so you always stay in the loop of when we're going to do another Facebook Live. And we're already going to tell you in advance that our next one is actually going to be during the week of June 18th, because that's actually World Continence Week. So we definitely want to spread awareness about incontinence, why it happens, and again, tips that you can already start to help change that. So stay tuned during that week for when we go live. And if you're just catching us now and you missed today's episode, we ended up talking about a lot of different bowel issues that you may not be aware is actually connected or related to your pelvic floor. And we talked about tips and resources that can be helpful. So if you're just catching us now, make sure to go back and watch the replay so you can learn all about that and get those resources. Awesome. So thanks so much. And thanks, Hannah, for coming on again today. And excited to chat in June.
I look forward. Have a good night, everybody.
Bye.